There you go. Good morning, everybody. This is Rolando Mia from Zyris, and we're on Dental Voice. Really excited today because we have a special guest, Dr. Dan Roberts, who is a periodontist that we work with, and very excited to hear about and understand the things that he's doing. When you look at the purpose of this, the purpose of our Dental Voice and the purpose of this discussion is to basically get to meet clinicians out there, understand their story, understand the things that they're dealing with today, and then get their insights and perspective. A lot of our guests have a lot of wonderful experience and wisdom, and this is what we're going to do. So, good morning, Dr. Roberts, Dr. Dan. It's a pleasure to see you, and thank you for coming on. How are you doing, sir?
I'm doing great, bro. And call me Dan, please.
Oh, okay, Dan, Dr. Dan.
I don't even let my team call me Dr. Dan. They just all call me Dan.
Awesome. So I'm going to call you. All right. Thank you for that. I appreciate that clarification. So before we begin and before we do anything, I need to get this off of my chest because, prior to our guests coming on and our speakers, it's always cool to understand what people are doing. And I hear that 4 out of 5 dentists recommend something that you do. And they recommend Novocaine, but not Novocaine with regard to the pharmaceutical, Novocaine with regard to a band that you're on. Is that correct?
That is correct. You can find us at Novocaine the band or Novocaine Rocks on Facebook. But this band started as actually it was a dental study group that was on a ski trip. A couple of guys were injured and they brought their guitars. And anyway, that was the inception of the band about 8 or 9 years ago. And these are guys that have been my friends for half of my life. And it's really a pleasure to have such a tight group of guys that we love practicing together and we love performing. And we've been able to we performed for the Dental Society. We played on the Midway down here in San Diego. We played at the San Diego Zoo for some fundraisers, and we play out in bars, for our friends. And so it's a great time.
That is awesome. So you are the first bona fide dental rock star that we've had on Dental Voice. So I'm kind of excited about that. That's pretty cool. So, all right, I got that. So Novocaine rocks. I love it. So you are a periodontist, correct?
Right? Yes.
And you're as a specialist. It's great to have you on, and I really appreciate it and looking forward to kind of your insight from a procedural perspective, from a periodontology perspective. This whole I'm going to start with what's most relevant and topical right now, and it's the fact that we're under quarantine and virtually everything is shut down. How is this affecting you and your practice and your team right now?
Well, I think it affects us just like it affects most other doctors. The first thing was we got to be down for 2 weeks. And I saw the writing on the wall. I said, 2 weeks is not going to be enough. That's going to get extended. I had no idea how long. But the first thing, everybody was panicked about, okay, what are we going to do with the practice? What are we going to do with our patients? And what are we going to do, importantly, with our team? I mean, the gals that work for me, gals and guys that work with me, they're family. And
yeah,
honestly, that was the hardest part of this was what to do with them, because I'm just looking at this going, wow, can I pay them? How long can I do that? Do I need to furlough them? And so that was a real difficult part. And I know that was tough for everybody, because I've been, talking to the guys in the band, for instance, we all text, and the guys and gals in my Spear study group, a lot of communication there. We got beyond that, and we're settling now into the new norm, which is we don't see very many patients. I tried to put off as many as I could, because I figured I don't want to risk them or to risk my team and transmit this disease. So we've really been putting off a lot of things, and now it's we're 4 weeks in, and there's some emergencies that you really have to take care of that just cannot wait for another month or whatever it will be till we can get back in the office. And those are some tough decisions as what can wait and what can't.
Thank you for that. When you say what can wait, from a if a general practice versus perio are two different, focus and specialties. What would a from your perspective, an emergency, how would you define what an emergency is for people who are listening right now, so that just for point of clarification?
It's interesting. I've got a lot of patients that I see stuff that looks like it should have been dealt with 10 years ago, but somehow they're still limping along. So people can live with stuff for a long time that you would think needs immediate attention. And then there's other people that are in pain and have facial swelling, and that's a legitimate emergency. You don't want these patients to get to the point that they have to go to the ER and expose themselves to in a medical facility. So what I look at, now that we're in this for a little bit longer, I'm starting to bring in some patients that I know, I have a list of patients. And I call them once a week. Hey, how are you doing? How's that? Is it worse? Can you tolerate it? And most of the time they say, yeah, I can tolerate it. I'll live with it. And because they don't want to come in any more than, they don't want to expose themselves either. But then there's some patients that are calling me and saying, hey, I've got pain. I've got swelling. The antibiotics aren't making it go away. We got to deal with these things. And I know my endodontist colleagues, they're working quite a bit because, you've got a toothache and you got to deal with that. So those are the kind of emergencies that we're taking care of is swelling and pain.
So it's kind of a situation where your patient is kind of at the point where they just can't tolerate it anymore, and
Absolutely.
you don't feel comfortable. But at the end of the day, you have to diagnose that. And I guess it sounds like you're doing kind of teledentistry, which is kind of the big thing that's coming up around now, where you're diagnosing on the phone or virtually. Is that right?
I do. It's interesting the photos I get when I ask them to take a picture of it. But yes. And that the good news is everybody's got a cell phone, everybody's got a camera. So we're able to do some things now that 20 years ago would have been impossible.
At some point, maybe not now, I'd love to see the kind of pictures that you get. You should maybe post those, because it's like, so Rolando, take a picture of your mouth. No, that doesn't work. But anyway, so from a team perspective, your team, in looking at you're with Encinitas Perio, and you've been doing dentistry now for almost almost 25 years. And
I wish it was only 25 years.
Or perio. Well, you started out as a general practitioner, is that correct?
Correct. Yeah. When I was in dental school, perio was considered the perio penalty box. And I never dreamed of becoming a specialist. I just wanted to do restorative dentistry. And I dabbled in endo and extractions and perio. And through that, I found, I got into a perio study club because I just found that I needed more information. Doing the procedures are the easy part. It's knowing what to do when is the difficult part. And the same is true now for implant dentistry. A lot of people do implants. And at first I was a little bit offended when one of my general dentist colleagues said, oh, implants are the easiest thing I do. And then I thought about it, and to a point, he's right. Drilling a hole and placing an implant is not truly a difficult thing, but it's knowing what to do when and where, and the site preparation and the materials, and that's the hard part. It's really the diagnosis and planning that's the hard part. So that's what drove me back into school to get my specialty certificate in perio.
So you went from thinking that in dental school, perio was the perio penalty box, to being a periodontist.
Oh, absolutely. And at that, when I was a general dentist, I really didn't understand the benefits of working with a specialist the way I understand them now. And I think it's important to have a good relationship with a specialist. For one thing, a specialist, we're here to take away your problems, your problem patients, your people that aren't uh, following your recommendations, people that are, that have a problem on Friday afternoon when you're on vacation. That's our job, is to take those patients off your hands and deal with that. So that's one benefit. But beyond that, we're also here to support your treatment plan in a couple of ways. One is, and I think it's so important that a general dentist gives a strong referral to whatever they're referring to, whether it's the orthodontist, perio, whatever. Pick one doctor, even if you work with a couple of perios, pick one and say, this guy's the best. You need to go to him or her. And because, the worst thing is when I get a patient that said, oh yeah, he gave me 3 cards and told me to pick one. Because the patient has no confidence in their doctor. If they think that you're the best one, then they're confident. And when that patient comes to me, I can say, oh, you are so lucky to be seeing that restorative doctor. That doctor, she did work in my mouth. And that goes a long way for a patient to have confidence in their providers. Then when you support their treatment plan and say, yeah, I think that's a good idea, let's get this done so that you can get back and get that restorative work done, that really goes a long way. So that part is important. Other things that comprehensive care and the ability to do multidisciplinary treatment. For example, I'm really good at treating gingival recession. And so I get some really extreme recession cases. And, recession just isn't caused from aggressive brushing. It can be clenching, and also what I'm seeing is a lot of sleep problems, sleep related problems that shows up on their teeth, acid reflux. So there's a lot of health problems that show up on teeth, and they're being sent for recession, and I'm sending them to their GI specialist, or I'm sending them to an ENT because they've got airway obstruction, or their orthodontist to have some palatal expansion so that they can breathe better. So the value of a specialist, we've got our 10,000 hours. We're really good at seeing these things, and we can help support comprehensive care and multidisciplinary care, which is best for the patient. And in the end, you're going to do a more comprehensive restorative as well. So
Thank you.
there's some value there.
I appreciate that. And just to sum it up, you highlighted 3 key pieces, which is great with regard to the relationships between general practitioners and the specialist. First and foremost is it's a support thing. So don't look at it as that. And from a specialist perspective, encourage the connection, which is very important. And the second point that you mentioned is this idea that you help deal with the problems and deal with extenuating circumstances that may come up or crop up during the course of treatment. And then also there's a lot more, it sounds like there's a lot more comprehensive, more complex cases that you're dealing with, and this helps offload that off of the general practitioner. Did I kind of capture that?
Yeah, and there's a final benefit that a lot of people don't think of. I get referrals from other doctors from out of state, out of town. Those patients need restorative dentists. So I'm able to refer patients back. I also get, we've got a big web presence, online presence. So I get patients that see my Yelp reviews and come from that. Again, I say, well, where did your general dentist send you? Well, he sent me to somebody, but I didn't like them. So I'm able to send patients back to restorative doctors as well.
Yeah, and I think the strongest message, and it hit me especially hard, is this is across any industry. When you're referring, make sure that you're referring with confidence, with an understanding, and with knowledge about whom you're referring to, so that it's not, well, here 3 or 4, pick one, it's up to you. No, I'm a doctor. I work with Dr. Dan Roberts. He is the best. Here's the thing. Go here. I'll even call him and let him know that you're going to be coming. And this gives you a much stronger connection with your patient, and enables you. Also, more importantly, I think it reassures the patient, hey, my doctor likes this doctor, therefore I like this doctor, as opposed to, I don't know. Did I get that, doctor?
That's, I mean, really, we're working as a team. And not only does the doctors need to be able to work together, but so does our team, our staff members. It really helps when they're familiar with each other. And so I really promote that as well, is knowing the whole office and making sure that both of our offices are on board with education together, learning together, and they're familiar with each other. And that's going to give you some really strong value, and patients see that. They really recognize that, and you said it, they're reassured.
Thank you for that. Now I'm going to ask you a quick question. You mentioned it. With the advent of technology today, there are so many systems out there that are so advanced and give clinicians so much information about the patient that, and I've heard it, and I love your perspective on it, and kind of to share, hey, I can use this system, and doing X, Y, or Z is a no-brainer because it tells me how to do all of that. And I'll use, guided implant surgery. What advice or what feedback would you give to people who are, kind of looking at that as a way to be able to do more complex cases?
Guided implant surgery is both a blessing and a curse. The blessing is that we can do all the planning on the bench, on the computer, before we ever get to the mouth. So it really is a time saver. There's certain cases that I won't do without it, because it's necessary when you're in tight situations. Close nerve proximity, close root proximities. It's wonderful. There's also areas that it's quite difficult to use, and if you don't get accurate impressions, if something goes wrong, and you don't confirm where your drill is, it can be disastrous. Fortunately, things are pretty accurate. They get it right, and so it's really helpful. But again, it doesn't take away when to do what and where. You still need to be able to diagnose that case. You still need to be able to figure out where you need to graft, all that. So it may make things, it may simplify things, but it also adds, there's other things that it adds that you have to be aware of. So it's both good and bad.
So just be mindful of the limitations of it. And then, as you mentioned earlier, there's always a specialist, and don't be shy. I guess, not to put words in your mouth, to ask or create a relationship with a specialist to say, hey, Dan, Dr. Dan, I'm working on this case. Any advice that you would give me? Oh yeah, be careful about X, Y, and Z. And if you have any issues, let me know. That sound rough, right?
That's it. That's it.
Oh, cool. So sorry.
So one of the things I know a lot of people are concerned about is, when are we going to get back to work? What are we going to need to get back to work? And what it's going to take to get back to work. And I just heard our governor yesterday saying, oh, we're going to have to social distance for the next 18 months until we get a vaccine. And I want to shoot myself in the head if that's the case, because just being with my patients this last week, doing a couple of emergency exams, having to sit there in the room with my mask on and talk to them about what their treatment options was really hard. Social distancing for a social people is very difficult. And I think when we get, what we're really going to need is to get some point of care testing, which we don't have right now, not readily available. Serologic testing, blood tests, similar to what you might use for diabetes, where you can do a finger stick and say, oh, look, he's got IgM, IgG antibodies for this. If he's got IgM or she has IgM antibodies, it means that you're still fighting the infection. If you got IgG antibodies, it means you had the COVID and now you're over it. That's going to really be a big boom. And then we'll find out what the incidence of this is, because I've talked to a lot of people that think they probably had this back in December or January, where they got the worst sickness of their life. So I think the incidence is way higher than what we know. And when we get that kind of testing, then we'll be able to treat with confidence and know that our patients are safe, know that we're safe to treat them. Until that happens, we don't know, and we have to treat everybody. It's just like the AIDS epidemic back in the early 80s. We didn't know who had AIDS, so what do? You had to take precautions, and that's really what we're doing now. We're ramping up our precautions because we've got, these droplets that we have to worry about. So one of the first things I did was I looked at my stock of Isolite mouthpieces. And I use Isolite mouthpieces. I've been using them for years, especially when I do sedation patients. I want to make sure that they're not aspirating fluids. And I use it when I do LANAP, laser surgery. I do it even when I'm placing implants, especially in the posterior area, lower posterior, where their tongue and their cheek are flapping. And so Isolite has been a value to me, and I'm really happy that I have units in both of my hygiene rooms and both of my surgery ops. So I figure I'm going to be using an Isolite on all of my patients where I can, because anytime I'm doing a procedure where I've got a drill in my hand, that's going to be aerosolizing virus as well as bacteria. And I want that suction, that high volume suction, to be taking that out of the air right there in the mouth and sucking it away down the suction, so it's not spraying out into the room or spraying on me or on my team. So that was one thing that I feel will be really valuable. We're going to put in a HEPA filter in the operatories, although I'm not sure that that's a big value. It might put some of our patients at ease. We're stepping up our personal protection. I don't currently wear a face shield, but that's something that we'll be doing. If we can get an N95 mask, we'll be using that on our patients with aerosol. We'll probably be dialing down the Cavitron and piezo scalar use with hygiene patients, just to reduce the amount of aerosol if we can. And other than that, it's wiped down. It's doing all the stuff that we do every day anyway. So those are some of the things that we're implementing in our office. I don't know if we'll need to go as far as like they do at the cash register with the plexiglass screens, like up in front with patients. But but we'll have to see. We'll have to see where we're at when they actually do open us up, and then adjust accordingly.
Oh, wow. And appreciate the comments about our system and also the context for preparing for that. Right now, you've got patients who are, who are sitting back and they're concerned about, this virus and everything that's going on. What, knowing what you know now, Dr. Dan, and knowing that patients are kind of apprehensive, what message would you want to give to the listeners or people who would be listening to this later on about engaging with you or engaging with their clinician before we get the finger test, before we get all of the I'm going to call it the technology to identify it? What would you want to let them know?
Ro, that is an excellent question because, first of all, we deal with fearful patients every day. Virus or no virus, they're afraid to come to the dentist. So I think that equips us to be able to communicate better than most people, because that's the kind of people we deal with all the time. But yeah, you're right. Patients have been walking around, people have been walking around out in public with masks on, and they come in your office and you're asking them to expose themselves and take their mask off. And that's just one more vulnerable thing. And then you're going to put sharp instruments in their mouth, inside their head. So it does put patients in a vulnerable position. But really, I think as dentists, we're equipped for that, because we do it all the time. With this, I think it's nice. I've seen some of my colleagues have already gotten letters out or letters on their website talking about exactly what they're doing. Some of the precautions that they're taking help put people at ease. One of the other things that I did is when I saw this coming down, I got a touchless laser thermometer. So I think that's part of the protocol as well, is just to make sure that your patients aren't sick. We test our team, first of all, when we come in and when we leave the office. We take our temperatures, and then we test our patients before they come in. We don't, I think it's going to be a while before you're going to be seeing patients sitting in our reception areas drinking a cup of coffee. We're keeping them in their cars, bringing them right back to the operatories. I just want less areas that my team has to scrub down and worry about. So putting the patients at ease and showing them that you're taking steps, I think is really important. And if you list it and send it out, we have RevWell. It's a system that confirms the patients, but it also is a good system for shooting out letters. You can, if you're on Instagram, Facebook, those are also places where you can get this information out to your patients. Just put them at ease before, answer their questions before they ask them, I think is the best way.
Yeah, I like that. I like that. So it's about making sure your patients know you're already taking steps, making sure, reassuring the patient, like you mentioned earlier about reassuring the patient that you see this, you understand it, you're putting steps in place, and we're going to do everything we can to ensure the safety of you as well as the other members of the team.
You summarized it perfectly.
Yeah, that's great. So from a team perspective, it's interesting in looking at your team. You look like you all have fun. You get along, and you mentioned it like a family. How's the team doing right now? And what advice would you give other clinicians out who are struggling because they've had to furlough their teams. They're not working right now, and there's uncertainty that's coming out. And you've been in practice, and you mentioned the HIV. You've seen these kinds of things before. What advice would you give people who are having that anxiety or that stress?
Well, at first it was hard to give advice because I was one of those people having the anxiety just like everybody else. I was having difficulty sleeping But I check in with my team. We're on a text feed with the whole team, and I'll check in with that, and then individually I'll touch base with them and just make sure they're doing okay. Yeah, I had to furlough my employees just like I think most everybody else has, and I they're getting their checks, they're doing all right, um, and right away at the beginning, I also you just made sure that they were okay, that they had masks, that they had toilet paper, that they had what they needed, because we've got that stuff at the office. So I just made sure that my team members could take some home and make sure they had, hand sanitizer, whatever, just so they'd be safe and their families would be safe. And I think we're all in a good place.
That is great, and I can tell that you really care about them, and I think that's one of the things I've heard, that in dentistry, dentists, clinicians are a really tight group of folks, and the fact that you're talking to each other, that not just your team but also your colleagues, it makes me feel good, and it's a kind of cool thing to hear. So thank you for that. Appreciate that. So, first of all, Dr. Dan, yes, it's weird. Doctors are doctors to me. So I hope I'm not somehow making you feel funky by calling you Dr. Dan. Actually, it sounds cool because you're a rock star. Anyway, so thank you for your insight. Thank you for the advice. I really appreciate the context around the relationship between specialists and the GPs. I think that's very important. If you were to kind of sum up, or people who are listening, and then this live stream, I'm going to ask you for your contact information for people who want to contact you. So, but before that, what final words or closing words or advice would you like to give our listeners or other people who will observe this and see this later on?
Well, I guess my best advice would be control the things you can control and try not to worry about the things that you can't control. I know this is a frustrating time. I mean, it's hard to stay fit when they're closing the beaches, closing the trails, closing the desert. Uh, it's all that is beyond frustrating, in my opinion, and in a lot of ways overkill. But it seems that we're, at least in California, we've been spared some of uh, the severity that they definitely saw in New York. So I guess that was all a good thing, and so I'm settled into the new normal. I'm trying not to let my device distract me. Phone, uh, emails, texts. Sometimes you just have to put that down and take care of your goals that you set for yourself during the day. And that's my best advice, is to set some goals, personal, business, household stuff, and hopefully I'll get to check some of that stuff off the list.
Yeah, we will get through this, is what I've heard, and I love the message around that, which is focus on what you can control, focus on what you can deal with, and not worry about the things that you can't. So that's awesome. Awesome. Thank you for that. So if people wanted to reach out directly to you or ask you questions, or just yeah, what would be the best contact so that they can engage with you? How would you like to do that?
Dan at EncinitasPerio.com. That's Encinitas, as in Encinitas, California. ENCINITAS is my best contact.
Okay, so, and we encourage people, it'd be okay if they had questions for you, it would be okay for them to send emails and all that type of stuff. Is that cool?
Absolutely. And if they want to check out our website, it's EncinitasPerio.com.
Awesome. Thank you. Thank you so much for the advice. Thank you for your time. The this is an ongoing forum, and hearing about the things that you deal with, and you sharing kind of how you're addressing that is always so helpful because you're dealing with right now. So, those of you who've been listening, if you like this content, or if you'd like to contact Dr. Dan Robert, please go to his website or send him an email. If you like the content, share this. And if you have any other feedback, or if you'd like us to focus on or ask other things, please let us know. Thank you, Dr. Dan. I hope everything is well. I love the picture behind you. Did you draw that?
No, my wife painted that.
Wow. And I see the guitar. So again, our rock star dentist. I'm loving it. I'm just going to call you our rock star dentist. So please be safe. Have a great rest of your week. And I look forward to talking to you again. Thank you so much.
Pleasure talking with you.
All right.